the Rural Surgery Innovations has developed this model or simulator and the laptop cystoscope to acquire minimally invasive surgical skills. This model looks and feels almost like the regular human tissues. Like the abdomen thickness is similar to the normal abdominal wall, so is the texture. And this is the penis, and the urethra also is soft and feels almost like human tissues. So this is a plug and play device which connects to any of the laptop cystoscope, laptops or even cell phones, and you can start learning or acquiring these skills. So for example, when you're doing the cystoscopies, you need to appreciate the various curves of the urethra. So here you can see, instead of poking and causing injuries, you can go at the center of the urethra without touching the wall, and then when you reach the bulbar area, turn the scope around and then identify the verumontanum, bladder neck, go into the bladder to identify the ureteric orifices, or go further inside to identify stones. You can also practice skills like DJ stent removal and DJ stenting and so on with this. In addition, you can also learn gas insufflation in less laparoscopic surgeries. So this is a special device which has a spiral ring which elevates the abdominal wall, and it's fixed to the OR table. Pull it like this. See, pull it. Okay. And here you can see the model of a gallbladder. You can also use instruments which are modified from open instruments because there is no air leak and problem. So you can have the gallbladder, you can lift the gallbladder, you can identify the cystic duct and the vessel here in the simulator. You can practice tying knots. If you want to practice appendicectomy, you need to pass the instrument in the direction of the scope if you're doing single incision surgeries. So all these skills need to be learnt. And before straight away going on and struggling in the patients, you can practice the skills in the simulator. So that's the base of the appendix. The appendix has a mesentery. You can hold the appendix and cut the mesentery and learn how to tie the appendicular stump and so on. So this gives the opportunity to practice real life surgical procedures.
We have multiple ports.
And you can also make the ports as we need for the cholecystectomies or appendicectomies. So it's possible to practice on the simulator the skills which are necessary, and then go directly to the patients once you are familiar with the skills, with the mentor or with the faculty who to assist you. So this offers a low cost option for learning the minimally invasive skills which are necessary to start doing minimally invasive surgeries on simulator rather than in patients, and at a low cost. So if we can, once you remove the gallbladder, we can add one more gallbladder and do the surgery again. Again, if you look here, this is the appendix and that's a mesentery. And if you notice that it's stuck here. So once you finish one appendicectomy, you can take it out and do the next one. And this is the bladder. In females, we have ovarian cyst and uterus and so on. So all the common surgical procedures can be practiced using the simulator.